Good afternoon. I'm David Sweat, Deputy Director, Shelby County Health Department, and welcome to the City of Memphis and Shelby County Joint COVID Task Force press briefing for April 1st, 2021. Jumping straight into the data, we can tell you that as of yesterday, we closed out with 91,349 cases reported in Shelby County. And that included 129 new cases reported yesterday. We also had 1,570 deaths reported so far, and that was one new death in the last 24 hours. In the surrounding counties, we've had 7,120 cases reported from Tipton County. We've had 4,794 cases reported from Fayette County in Tennessee. We've had 20,555 cases reported from DeSoto County in Mississippi, and 5,510 cases reported from Crittenden County in Arkansas. And if we could pull that graphic back up, one change that has been made that I want to bring to people's attention on our daily updates of numbers that we provide from the Shelby County Health Department relates to the number of people vaccinated. And in the past, we've been reporting the total number of doses of vaccine that have been administered, but of course we're dealing with multiple vaccines that have a 2-dose series. And we were getting a fair number of questions about, okay, you've done 330,000 vaccinations or shots, but how many people have been vaccinated? So in this graphic, the change we made is to really emphasize the people that have been vaccinated. So yesterday when we were running the data file, at that point in time, it was 222,548 Shelby County residents had been vaccinated. 112,352 of those people had received one dose of a 2-dose series, and 110,196 people had received either both doses of a 2-dose series or had been vaccinated with the Johnson & Johnson vaccine and therefore were considered fully vaccinated. If we can move to the next slide, please. So we're still tracking the total number of vaccine doses administered. Yesterday, when we were running this, it was 330,244 total vaccine doses administered, with 37,271 in the last 7 days. Next slide, please. But those 330,000 doses have been delivered to 222,548 people. And if we could show the last slide, please. This is the way we're tracking our progress toward our campaign goal of 700,000 Shelby County residents being vaccinated. And you can see that the 222,000 people bring us to 31.8% of our vaccine campaign goal. So if we have any further questions in the questions and answer period, we'll be happy to address those. But right now I'm going to turn it over to Chief Doug McGowen to give us an update on the vaccine campaign.
Thank you, David. Well, since vaccine became available and the task force took on the mission of vaccinating Shelby Countyans, we've been working every day to grow our capacity to match the vaccines available to what was being provided and then to deliver expanded opportunity to reach populations in every corner of the county. And during that time, we've grown from under 20,000 per week to more than 30,000 per week. And as David just said, we're approaching 340,000 vaccines that have been delivered, more than 200,000 people that have been vaccinated, and 100,000 that are fully vaccinated, and we intend to grow that as we move forward. Importantly, we've also increased the number of non-public pods through private providers to more than 60 providers all across the county, and that's an important step to normalizing vaccination so that many people would choose to get their vaccine from their local pharmacy, their doctor's office, a clinic, and or someplace like CVS, Walgreens, or Walmart. In addition to the 5 fixed site pods, which are a general approach to vaccinating the public, a more specific and targeted approach for areas with low uptake or particularly vulnerable populations is our community pod program that we deliver primarily in conjunction with our neighborhood churches and some nonprofit agencies. So far, we've completed about 10 of those neighborhood pods, and we have another 20 that are already on the books and scheduled. including an event today that's happening at St. Paul Baptist Church down in the Whitehaven area. For folks who are asking about J&J, we did a pop-up pod yesterday and delivered 1,000 doses of J&J, and today we're actually delivering another 1,000 doses at the St. Paul Baptist site. We expect an increased allocation of J&J that we'll be able to begin delivering all across the city next week. So as we move into this holiday weekend, we're really positioning ourselves to take the next big step in our capacity, and it's also going to increase our speed and the volume of vaccines and the way in which we get them into arms of people in our community. So next week, we're going to schedule more than 52,000 appointments at our public pods and our pop-up pod sites. That increase, many of you have heard the news that a partnership has been forged between the city of Memphis, Shelby County, the state of Tennessee, and FEMA so that we can establish what they call a community vaccination site. That site will be established at the Pipkin building. It is already one of our high volume sites. It's really going to accelerate and expand the great work that is happening at the Pipkin building. It will come with a separate allocation of 21,000 new vaccines each and every week on top of the allocation we're already getting. That site will operate, instead of 6 days a week, it will operate 7 days a week. And instead of 10 hours a day, it will be operating 12 hours a day. So 12 hours a day, 7 days a week at the Pipkin building to deliver 21,000 additional doses over and above what we've already been doing. Now to do that's a huge logistics effort. We needed additional pharmacy-grade freezers, refrigeration capacity. All of that has been secured. Our partnership with Regional One is strong, and they are a great partner in helping us to deliver this vaccine by storing it for us. We needed to coordinate between the many new partners who are coming to help us. In addition to bringing the vaccine, they're going to bring some personnel to help us administer the vaccine. So we need to align our processes and protocols, make sure that everybody has the same sense of customer service. We have to also coordinate the lodging, arrival, housing, transportation for all of the folks who are coming in to help us do this work. And then if you've been by the fairgrounds, you'll also see it requires us to erect an enormous tent on the fairgrounds site immediately adjacent to the Pipkin building. This is the size of a football field. When it will be completed over the weekend and be ready for operations next week. We will be doing a dry run next Tuesday, and on next Wednesday we expect to be at full capacity. Now today, we have more than 9,000 appointments scheduled all across Shelby County. During the holiday weekend, we are going to continue to deliver vaccines both through our private partners and through some of our public pods in Whitehaven at the Pipkin building. And our team is going to continue over the weekend to do that heavy lifting of being prepared for that significantly increased volume next week. That's all the stuff that happens behind the scenes before you actually get to the vaccination site. There's some training that has to go on. There's some documentation that has to happen to make sure we're all aligned and we can step up to the plate to do that high volume next week. Tuesday, April 6th, will be our last day of what would be considered the current operating model with the 5 fixed sites and a few pop-ups that we have every single week, our community-based pods. And on a Wednesday, April 7th, we will activate Pipkin as the 3,000 dose per day high volume site. That will give us the opportunity to put more doses out at our other fixed site locations and also give us the ability to fully source with vaccine all of our community-based pods throughout the community. And that will also amplify our ability to continue to do homebound and homeless populations. Today, we have a team that is doing a homeless vaccination in partnership with the Hospitality Hub, where they expect to do more than 150 individuals just today, and they will continue that work as we move forward. So it's an exciting day for us to get a significant increase in vaccines that will begin next week. We want to get those numbers on David's chart to go higher and higher. If we fully execute the plan that the federal government is giving us those vaccines for, it will result in 63,000 fully immunized individuals at the completion of the 6 weeks. So with that, I'll stop and take any questions that people may have.
Dominique Dillon, Fox 13.
Good afternoon. I was just wondering, with transportation for the community vaccination site, do you plan on teaming up with MATA? If so, how will that work? And also, what will the hours be at the site?
Okay, so that's a really good question. Sorry for not mentioning that. The hours at the site will be 8 a.m. to 8 p.m., 7 days per week. Yes, MATA is our partner in this effort, just as we established at the beginning of the pandemic where we had rides to testing. They will continue that program. We also are working with, in addition to bringing vaccines to our church partners, we're asking our church partners to help us bring people to the vaccination site. One thing we know that most of our churches have is a van or a larger kind of a transportation system that they can use to get people to services. We're going to ask them to help them bring people to us. We'll help them schedule appointments. We'll have a fast pass lane for them to come in and to get access to the site so they can get in and out very quickly. So yes, a robust transportation plan to bring people to the site.
And then also, there's reports that 15 million Johnson & Johnson doses were ruined. How do you think that might affect our supply?
Well, for now, everything, I just want to be clear, those are vaccines that have not yet been produced or put into distribution. So all of the Johnson & Johnson vaccine that we have and that is coming to us is safe and effective. None of that has been affected by this. What this will do is down the road may impact the flow of J&J vaccine. It's 15 million spread across the entire country. So, our percentage of that is very low. So I think you won't see a significant impact to our supply of J&J. Obviously, we have been not receiving a heck of a lot of that anyway, but it just might mean a little more delay for the country as we move into J&J mass distribution.
Brad Broders, Local 24.
Good afternoon, Doug. Thanks for the opportunity, as always. It's good news, obviously. We have a lot more inventory coming in starting next week. But how does this, in your view, kind of accelerate the stakes of education and participation? And are there any additional plans underway to sort of expand the virtual campaigns that you already have done?
Sure, and that is part and parcel of this effort, is to make sure that people with social vulnerabilities have as best opportunity as they can to get access to vaccines. So I will tell you earlier today, the reason we rolled this press conference to 1 o'clock instead of 2 o'clock is we were doing our final concept of operations with the FEMA headquarters team. Of the hour that we spent with them, we spent 40 minutes of that hour talking about how we will get messaging out to folks in the community that this is important, how we break down barriers for people who are vaccine resistant, and how we make sure that we really do aggregate, analyze, and respond to the data that shows us whether we're making progress or not, so that we can quickly pivot and get more folks in to get a vaccination.
Thanks, Doug. And follow up, you touched on this a second ago, but can you kind of elaborate or expand on how these extra doses and the staff that had been at Pipkin, how they might be sort of spread around specifically across the county now that they're sort of freed up?
Sure. Well, there's a few things. Number one, since they're bringing us an additional 3,000 vaccines per day, the 1,500 or so that we had been allocating to the Pipkin site can now be distributed throughout the other fixed site pods. We will grow slightly next week. The same provider that runs Appling and also runs the Pipkin building, that is University Clinical Health. In order to make sure that we can fully staff 12 hours a day, 7 days a week, we'll be bringing back the hours of operation at Appling to about 4 days a week instead of the 6. But the communities of Bartlett, Lakeland, and Arlington have stepped up, and they will be offering at Faith Baptist Church starting next Wednesday through Saturday. So we'll scale back a little bit at Appling, but the folks in Bartlett, Lakeland, and Arlington will pick that right up, so there's no loss of capacity. Actually, we'll gain a little bit more capacity. We have another community partner we're not ready to announce yet, but we're working on another high volume site in one of the areas where we need to have that. We expect to have that finalized by about next week and maybe start operations on April 12th. So more points of delivery, more vaccine to deliver, more opportunities to do community-based pods.
Michaela Watts, Commercial Appeal.
Hello, good afternoon. I just kind of wondering, with this new sort of windfall of vaccine amounts, does that move our target date for herd immunity up at all?
Well, I'll let David talk to the specific target, but We still have a very high goal to get to herd immunity. Because of the age range, unless we get some relief from the age of 16 and up, it's going to be realizing 650 to 700,000 was the original goal that was expressed. That means largely almost every adult in Memphis and Shelby County needs to get vaccinated. So we're hopeful there's some promising news there with the under 16 crowd that might come forward as early as the fall. I won't get into a detail about what the goal is, except to get there as fast as we possibly can. And your point is right on target. This new allocation of vaccines will allow us to go faster and to have a more broad reach throughout the community. So we're just going to continue to put our foot on the pedal and accelerate. And every dose that they give us, we will grow capacity to deliver that across Shelby County. Did you want to? Yeah, go ahead, David, sir.
Yeah, and thank you for the question. You know, we do not have a date in mind for hitting our target. What we have is a number, a target that we want to reach. And so obviously getting for several weeks, it could be 6 to 8 weeks of an additional 21,000 doses of vaccine available can help us accelerate our efforts to reach that goal. And the target is really an important goal. For herd immunity, the 700,000 is the bare minimum, right? We really would like to go beyond that number if we can, but if we don't get to somewhere between 650 and 700,000, we won't reach herd immunity. And so the consequence of that would be the virus would still find plenty of susceptible people to infect. And one of the things, if I can combine this with some news stories from earlier this week, is this issue of the growth of the UK variant as becoming the dominant virus in our community. And what we've done through some analysis earlier this week is look at the distribution, the age distribution of people who are infected with the UK variant strain. And what we see very clearly is 69% of all the people who have been infected with that particular variant are less than 45 years old. So it's people younger than 45 have 69% of the transmission of the UK variant so far in Shelby County. The vaccine protects against the UK strain. And one of the messages that we're trying to get out to anybody is get your vaccine, get your shot. It's available. We've got an expanding capacity to deliver doses of vaccine. But if you are less than 45 years of age, we specifically want to encourage you to come out and get vaccinated, because in that younger age group, people in their late teens, their 20s, their 30s, and the early 40 to 44 years old, that's where the variant is spreading the most. And this vaccine can protect you. The UK strain is 50% more transmissible and 30% more lethal than the COVID virus we've been dealing with all along. So we definitely want everyone to come out and get vaccinated, and especially including those who are younger than 45 years of age.
Great, thank you so much. And my follow-up question sort of builds on a couple of points you touched on around vaccine hesitancy and messaging. Previously, well before the vaccination campaign really got going, we used to sort of talk about this flipping point where initially demand was going to far exceed supply. Are we getting to a point where that's starting to even out, or are we even possibly approaching a point where supply is going to exceed demand due to issues like hesitancy? Where do you see Shelby County in this effort to really promote these vaccines to the public and spread truthful information about them?
Sure, I'll briefly touch and then give it back to Doug for the rest of the answer to that. Right now, we are not at the tipping point of having more supply than demand. But we understand that day is coming. And what we're trying to do now is prepare for expanded marketing and outreach to encourage people to keep coming out to get the shots. We're not to the point of transition there yet, but we understand that that day will come.
Well, I think we'll find out next week. Anytime you jump from 30+ thousand appointments to 50+ thousand appointments, we'll find out how quickly they fill up and what demand there is. And we will continue to advocate to receive more vaccine until we actually reach that point. We saw a week or two ago where there was a little bit of hesitancy to fill up some of the appointments. Those were second dose appointments. Kind of our basic analysis was that we just didn't have the right mix of first and second dose appointments, and then some people had actually scheduled 2 second dose appointments and taken one, and that left another open. Our response to that was to flip more first dose appointments open. What we've seen this past week and a half is that second dose appointments are outstripping first dose appointments, meaning that the folks at the beginning of the pandemic that got their vaccinations are now catching up with second dose. So I think we'll find out next week as we roll this out and we significantly increase our supply. My hope is that as we open those appointments that they will fill up and that we know that there's going to be continued demand in the community.
Kelly Roberts, WMC.
Good afternoon. My first question is a little bit about how the community vaccination center will work to y'all's understanding. First, could you expand a little bit more about the MATA partnership for those who may not be aware of that? And being that, the facts that we got from the White House COVID-19 response team and FEMA really talked about, they liked Pipkin because it was close to public transportation, that many Memphians do have issues with transportation. The way that this site will work, will it be a drive-through like we see at the Pipkin site right now, or is there a chance that it is going to be a walk-up kind of method as well?
So that's a lot of questions rolled into one, but yes, we will get specific information out on the MATA partnership and other transportation. That was something we identified this morning that we need to be more clear with those. I will tell you that it is a work in progress right now. We're continuing over the next few days to make sure that we have that wired and to make sure that all of the partners can deliver what we're asking them to deliver, and then we will help with the point of access on our website and through the call number. It will be, the expansion will be to go from 2 drive-through lanes to 4 drive-through lanes. But to be clear, at Pipkin, there is still a walk-up option today for people who cannot sit in the car. People who are transported can walk into the Pipkin building and receive a vaccine. We will expand that capacity as well. If you can think of a church partner who may want to bring 5 or 10 or 20 individuals in their church van or their church mobility vehicle, then clearly we're not going to go on the van and vaccinate. We will disembark those individuals just like a walk-in clinic. So it will have provisions for both.
Thank you. And just my last question is if you could remind us of just how many doses were being allocated next week and how many are J&J?
So we're setting 52,000 appointments. We anticipate that the majority of the vaccine we'll be putting out will be the Pfizer version, so probably 40 to 42,000 of those will be the Pfizer version, and we may have up to 10,000 doses of J&J that we can put out next week.
Those are all of our questions today. Are there any closing messages from any panelists?
I will just say this is an exciting time for us. We have been waiting for a big uptick. We believe there's demand. I will ask everybody here who is an influencer, if everybody just tells one friend, go get your vaccine, you get your vaccine, and tell your friends to come with you or tell them what your experience was like, we will get there. This is our time. Many people have had it with the pandemic. We understand that. We've asked you to stay the course. You all have helped us do that over the last year. We're at the 1 yard line here with our ability to get through this. I'm not saying we're through it at the 1 yard line of time, but I'm saying we have the resources in front of us. We have masks and social distancing. We have lots of testing. And the missing ingredient that punches across the goal line is vaccination. But we need the team to get on the field and punch the ball across the goal line. That's all of you coming to us or us coming to you to give you a vaccination. And that's how we're going to get through this and get across the goal line. So I would encourage everybody to take advantage of the new opportunities that we're going to have and get your vaccination. Thank you.
Thanks, everyone. We'll see you back here next week.